said, it's been a while. I've been doing more of Zoom, so I've forgotten how it works.
It'll come back to you. Studio.
Smooth 98.1. Here we are, 17 minutes gone past 5 o'clock, and it is way past time for Smooth Health for a Thursday evening on the Smooth Drive with Ayo and myself, Sope Martins. And today, I'm very excited because we've got a guest in the studio, Dr. Cassandra Akinde. You might know her as the Tropical Doctor, and she's a public health specialist, and she's come into the studio to have a little discussion with us about well, something that we have started hearing a lot about here in Lagos, which is diphtheria. So we're going to be talking about its causes, remedies, symptoms, and all whatnot. Basically, just having a whole 360 view on diphtheria and what we can do to protect ourselves as well. Dr. Cassandra Akinde, good evening. Welcome to the show.
Good evening, Sope.
Hi, thank you so much for joining us.
Thank
today.
you for having me. I'm happy to be here.
All right, so we've got tons of questions for you, but also if you have got your questions, people, send them in. You can send questions, comments to 0809 444 981 up on WhatsApp.
That's
we
right.
are also streaming live on youtube.com/smooth981fm Lagos, so you can go catch the replay if you would like after the show. And is there anything else? Oh yes, hashtag smoothhealth981 up on Twitter as well. Yeah.
All right, let's jump right into discussion for today. So Dr. Akinde, can you explain to us what diphtheria is? I mean, for those who have no idea, because a lot of people probably hearing this for the first time, can you just explain what it is and how it's actually spread?
Okay. So I think the first thing to note is that diphtheria is not a new disease. This disease has been, existing since 18th century or so. So it's nothing new. But yes, basically what diphtheria is, it's a highly contagious bacterial infection that is caused by a bacteria called Corynebacterium diphtheriae. So this particular germ, let me just use that word.
Okay.
This particular germ is a very special type of germ, because unlike any other type of germs that cause diseases, this particular one has this mode of action that has these toxins, which are called endotoxins. Okay, so usually these germs can be found in the air droplets. It can also be found in contaminated objects, contaminated surfaces. Yes, so that's why it can be spread from person to person. Okay, and that's through contact with secretions.
Okay, like bodily secretions.
No, not bodily secretions.
Okay, what are we talking here?
So let's just say, first of all, we need to take note that this particular disease, diphtheria, it affects the mucous membranes of the nose and the throat, and sometimes the skin. Okay.
Okay, because I've heard about one of the symptoms being that kind of white film that you get.
The gray coating film that can be found on the back of the throat. Yes.
So what would it look like on the skin? Like what would we be looking?
So on the skin, it's very rare. On the skin is a different type of mechanism. It's not the same the way it affects the pharynx, the throat.
Okay.
It's different. But on the skin, anyway, we can talk about that during the symptoms. I'll explain more.
Okay.
And the signs. But yeah, so like I said, it's important to note that it affects the mucous membranes of the nose and the throat. And so as a result of that, it can cause these toxins that are made from these germs. It can actually cause bacteremia. So basically all these bacteria can get to the bloodstream. And if it gets to the bloodstream, it can cause complications depending on where it gets to. Okay. So like I said, this bacteria causes toxins. They have toxins. So these toxins, once a person is infected, and yes, it affects the throat. So now, if it decides to get into the bloodstream and go further than where it's supposed to be,
then the sky is the limit for the germ.
then the sky, because if it gets to the brain, it can cause paralysis.
Whoa.
If it gets to the heart, it can cause myocarditis.
Dr. Cassie, can you not
What?
Wait, hold on now. We don't need to go from 0 to 60 to 100 in
That's
60
100.
seconds.
Okay, so
Wow.
let's just say that it's a highly contagious disease and it's a severe disease and it can lead to serious complications. So that's why it's important to talk about it.
Okay, wow. Now, we're actually having this discussion with Jalila at our intern, and she said that from the symptoms that she had heard about, that it sounded like something, because she said didn't know it as diphtheria, that she knew it as, what was it, belu belu?
Yeah, Billy Billy or something.
Something like that.
Maybe
So does it have
a-
any local names that perhaps you come across?
It should definitely have, but I have not come across. But I'm sure they have local names in different dialects.
Okay. Well, for her, I think it was. Hopefully, you can send your messages in.
Yeah.
I'm pretty sure she said it was.
For those who know the disease and know some local names that it's called by, yeah, you can let us know by sending a message on WhatsApp 0809440981. We would love to see what you have to tell us about that.
All right, now let's talk about those symptoms. All right, so what symptoms are we looking at, and how would we then go on to diagnose diphtheria?
Okay. So, like I mentioned before, the mechanism of action of this particular infection is very interesting because it produces toxins. So once the person gets infected, okay, the person might develop symptoms between 2 to 10 days. Okay. And so the symptoms that you might first see, first of all, because it will affect the nose and the throat. And so, of course, the nose, you might be having catarrh. The throat, you might be having sore throat. And because it's an infection, you must definitely have fever. You might be having weakness. Okay. Now, because it's also affecting the throat and some of the other respiratory tract, it can also affect your breathing, right? And so apart from that, the toxins can also cause the swellings of the lymph nodes.
The lymph nodes, okay.
Yes, at the back of the throat. And so it just simply means that there will be swelling. And of course, if you have that, you might have hoarseness of voice, that means your voice will change. And then of course, you might have difficulty in swallowing, difficulty in breathing. Okay. So some of those are the symptoms that you would see immediately. And like I said also, depending on where these toxins have gotten to in the body, can cause complications.
Okay, we're bracing ourselves now, because after that paralysis, you can go ahead and share some of those complications with us.
Okay, but before then, let me also mention that apart from the nose and the throat, in rare cases, it also affects the skin.
Okay.
And so if it affects the skin, what you will see is ulcers, right? Ulcers on the sores on the skin.
Oh, wow.
Okay.
And of course, because it's a sore, it will be inflamed, so it will be red.
All right, so but that's in rare cases.
Yeah, in rare cases, usually it affects the usual place for its infestation is the nose and the throat.
Okay.
The whole respiratory tract.
All right, so you've heard the symptoms. If we've got catarrh, sore throat, fever, weakness, hoarseness of voice, or difficulty breathing or swallowing, right?
And enlarged
and
neck swelling.
Neck swelling from your enlarged lymph nodes.
Mm.
Well, you might want to check yourself out. But so here's the thing, right? So we see the symptoms. I've got my swollen neck and can't breathe, can't swallow, or hard to breathe, can't swallow really. How quickly do I need to get myself to a doctor, and what happens after that?
Yeah, so if you suspect that you're having symptoms of diphtheria, you have to go and see the doctor immediately. So now, doctors are always trained for this type of cases, and they have to have high index of suspicion.
Okay.
And so after taking history, after asking you some questions regarding what were the symptoms, what did you do, and all that, they'll now examine you. They'll now look at your throat, and if they see that grayish membrane, because that's like I said, there's like the most significant sign that
one stands out.
See it, exactly, and they will see your enlarged lymph nodes at the back of your throat. They will know that definitely this is it. Okay, and so once they see it, they can now take a culture of that particular site and then send for diagnosis. But they are not going to wait for the results to come out. They have to start treating immediately once they made their diagnosis based on the history and the examination. And so they'll start treating with antibiotics,
Whatever is needed,
with antibiotics
right?
antitoxin treatments.
Wow. Okay. So why would they not wait for the results to come back before starting the treatment?
Because the severity of this disease, it infects so quickly and it can get worse.
It can spread.
So
to
now
other-
I know, like with some of these other, with all of the other contagious infectious
Infections.
diseases that we have, that there's a particular window in which you're like at your most contagious. When it comes to diphtheria, what kind of window are we looking at? Is that before the symptoms have started to manifest, or is it when you start noticing them or after?
So it's like usually a week. So that week, once you don't do something about it, it may lead to fatality.
It may or it might, because may sounds very, very, very strong here.
It may, say 10%
Oh wow.
of people who end up with diphtheria can actually die, especially children.
Oh my goodness! Wow. Okay. So people, I hope you're listening. Now, is face masks? Are they helpful? I mean, I know they're helpful generally, but when it comes to
This particular,
containing the
you know.
contagion, can they be a helpful tool?
Well, considering the mode of spread, like I explained, it's through respiratory droplets.
Yeah.
Right. And so, or if, for example, someone close to you, that's what I mean, person to person, is sneezing or is coughing, and you are in very direct contact with that person, right? Of course, because you have contact with the person's secretions, so you might get infected. So definitely, if you are covered, the risk of you getting infected reduces.
Okay.
So yeah, it is helpful.
Okay.
It is helpful.
Good.
Okay, so you mentioned earlier that treatment is started with antitoxins and antibiotics as well. So, what are the chances of recovery? Somebody has been diagnosed. What are the chances of that person recovering fully from this disease?
Oh, very high, like 95%. Like I've seen children with diphtheria. Okay, and once you diagnose it, you just give the treatment as soon as possible, and the children get better. It's unfortunate when this our society, when people don't know about this disease, people are a bit hesitant to go to the hospital, or
And
might
especially
not
we
trust
self-treat.
the hospital due to different experiences. And of course, like you said, would prefer to follow their own treatments based on hearsay and their beliefs, their social norms. And of course, when that happens,
Wow.
people die.
Yes. So let's go back to this death before we take a break, because the break is coming up. But we've been circling around this issue of death for a while now. So let's just face it front on. So can you give us like percentages or give some figures for, let's say, people who don't get treated? Does it always result in mortality, or are there people who somehow can get better?
Fight it off somehow?
No, like I said, it depends, but only 10% of the people who get infected get those complications. Okay, which I mentioned:
Okay.
the renal failure, the myocarditis, the paralysis.
You
and
only
all
mentioned
that.
paralysis.
Sorry,
I'm
what
hearing
is
the
sorry,
rest
what
of
is
them
what
now.
is what is what is myocarditis before we go on this break?
Yeah, so it's basically inflammation of the heart muscle.
Okay.
And so that's because the toxin will deposit on the heart muscle, and then it will become bigger and bigger and bigger. And when the
wow.
heart becomes bigger and bigger, it's difficult for it to function.
Wow.
And that will
Alright.
cause heart
Yeah.
seizure and all those things.
Failure. Yeah.
All right.
Okay.
It's time for us to go on this break. On the other side, we'll continue the discussion with Dr. Cassandra Akinde. We're talking about diphtheria. Don't go anywhere. Stay tuned.
This is Smooth Health on the Drive.
This is very loud.
Oh, you can actually
you
turn
can
it
turn it
down.
up.
Sorry.
Really?
Yeah, so you have control, this little control box. You can turn it down or you can turn it up, whichever one. I've turned it down for you.
Okay, thank
So
you.
you can. I'm so sorry about that.
This is not my house, so I don't even know anything.
Yes. Oh my goodness. So,
Don't be afraid.
it's alright. I have many masks at home. I shall be going around with them. But I know that yeah, it's not new, but do we get like what's the word I'm looking for? do we get regular outbreaks of this? Because it just feels like it's only recently that people have been talking about it here in Nigeria, here, at least in Lagos.
The reason why it's we are currently having an outbreak, majority because our vaccine coverage is low. For
Yes.
children specifically. I mean, I'm sure you heard that all these children that have died, right? Majority of them must have not been vaccinated. That's why they end up dying.
We're going there now. Vaccination and
Yeah, let's talk about it now. Okay. Okay, so what questions did we get up to?
we got
Okay,
up
we talked
to-
about treatment, right? Chances of recovery 95%.
Yeah.
How can it be prevented?
Yeah,
What can it be
that's
prevented?
primary.
Okay. Yes. I'm a big fan of vaccinations. All these anti-vaxxers that we see, people who don't want to vaccinate their children, although that's not the case in Nigeria. But like when you see another country, in Nigeria, we're looking for vaccinations.
Some don't.
Yeah, okay, there is that because of the conspiracy theories, right?
But no, but aren't there basic vaccines that if you don't give these kids, they're going to end up having like polio and whatnot?
Yes,
I
now the
mean-
pentavalent vaccine.
This is Smooth
And people will say,
Health
well, we're
on
not
the
vaccinated.
Drive.
Anyways, each to his own.
This
Well, you
is
know,
Smooth
there's
Health
been
on
the whole,
Drive.
oh, they want to sterilize us, they want to do this. Let's get back in. Smooth 98.1, 33 minutes gone past 5 o'clock, and this is Smooth Health on the Smooth Drive with Ayo and myself, Sope Martins. And today we have got Dr. Cassandra Akinde in to speak about diphtheria, the causes, the symptoms, the remedies. And we've been talking so far, you know, we've heard the symptoms and what we need to do and whether face masks can be a helpful tool, seeing as it is respiratory, passed along the respiratory. Wait, what's the technical term for this?
Respiratory droplets.
Thank you. That's the one. Okay, now we're going to talk about prevention. So we're having a rather interesting conversation off air that I think we need to bring back on air now. And that is, let's start things off with, can diphtheria be prevented? And if so, how?
Yeah. So diphtheria can be 100% prevented. And the best mode of prevention is vaccination. Immunization with the pentavalent vaccine,
Okay.
which is part of the national schedule for children, okay, under 5. And usually that vaccine is the pentavalent. So there actually has 5. So from the name pentavalent, it has 5 vaccines.
Penta.
Okay, so diphtheria, pertussis, tetanus, Haemophilus influenza B, and hepatitis B vaccine. So those are the 5. And so diphtheria is part of the pentavalent. And ideally,
Well, in that case, it should be case closed, shouldn't it?
yes, but as it is right now, only 70% of children in Nigeria have that vaccine, have been vaccinated.
Wow.
Hmm.
Yes, the vaccine coverage is still very low in Nigeria.
What might be some of the reasons for that?
Well, there are various reasons why some people might be vaccine hesitant. Some might be due to religious beliefs, some might be to their own personal beliefs, some might be due to distrust of the health system. So different reasons.
Well, I'm hoping that if there's anyone out here listening who hasn't had their child vaccinated, no, I'm sure you have. But if you haven't, now is the time to do so. Okay.
Sure that. Is there anything being done at the moment? I mean, to try and push that drive for vaccinations to get that level from 70% to maybe 100%, perhaps?
Yeah, I mean there are various campaigns by the government, you know, at various levels, local governments. So the various PHCs, primary health care centers, are currently trying to sensitize more of the community influencers because they understand the importance and the roles that the community leaders have over people. You know, so I mean community leaders, I mean traditional leaders, I mean religious leaders, I mean the market women, the market women association.
Yep.
It's all those community structures. So
Okay.
yeah, there are lots of efforts made into it, but of course we all need to step in.
Yeah, we all need to
Yeah,
do
we
our
want to do
parts.
our own part and try to change things around.
Now, for let's move away from the childhood vaccination and immunization and move on to adults now. Is there anything like a booster shot that we should be thinking about getting as adults?
As adults. So uh, so I think I forgot to mention that. So children who are not vaccinated can get the disease, but also people who are above 60 years old can also get it. They are more at risk, and that's because their immunity can be, waning.
Yeah.
And also people who have immune disorders like AIDS, right? Those are some of the people that are really, really, really at risk. And of course, people who have never been vaccinated just due to, I don't know, certain reasons, because ideally, if you are born in Nigeria, I believe you should have had that vaccine, but some might not. And so when you are visiting some countries, or you are born in a country where it wasn't part of the national immunization schedule, that's something to take note of.
I mean, we all have the mark of our vaccination, right?
Oh, yes.
Yeah.
Yeah,
So,
but
On my
yeah,
left shoulder, I think.
that's for
it's my left
BCG.
shoulder,
That's for BCG.
Oh, is
for
that it?
tuberculosis, yes.
Okay.
That's not.
I
the-
thought with all
thought that was-
five of them that it would
like
be
every-
this
like
one because
there.
it's
No,
just
no. So they're different. So BCG has that particular mark. So that's how
Okay.
you know that you are vaccinated against tuberculosis.
oh
And like I mentioned, the DPT, that one is a different thing altogether.
okay.
So some people might have not been vaccinated. Okay.
And so you wouldn't know until you get one of the diseases.
No,
that you've not
usually
been-
you should know because there are records for it. Right? That's
Huh.
the reason for records. You have your card.
Have you met our parents, Dr. Cassie? We're still looking for my birth certificate.
Okay, so but the ideal thing is that, so yes, if you know that or you suspect that you haven't had, yes, you can get a booster dose for adults.
Okay.
Okay, that's actually good to hear. That's relieving.
Yeah, so you can get it
If I
every
can
10
put it that way.
years
Every 10 years.
All right, and that
Okay.
would be you requesting at the
at the primary healthcare center.
okay.
Yes.
All right. So let's talk about diphtheria today. How common is it, among us, and what populations are most at risk of contracting this disease?
Okay, so it's quite common, right? And the populations, I think I've mentioned the children who are unvaccinated against diphtheria,
Over
Okay.
60s. Yeah.
and people who are older than 60. Then we talked about people who have immune disorders, those are people at risk, and people who are visiting countries that have not been vaccinated before. Like for example, when I was born, I wasn't born in this country, so I was never vaccinated against yellow fever.
Ah.
So it's only until I got here that I had to get vaccinated.
Mm.
So sometimes if I've gone somewhere else and it's not part of their regular vaccination schedule, once you know that, you better make sure you, because in the environment you are, it's
Yeah.
endemic. So it's
Yeah.
best for you to get vaccinated against that.
Okay. Now, can we talk about some of the common misconceptions that are floating around about diphtheria, and also any kind of home brew remedies that people are taking that you would like to say, okay, let's not do that?
Okay, so I've come in contact with quite a few. So I'll just say that traditional medicine specifically, I wouldn't want to say that it's completely wrong, but at the same time, people don't know what exactly the traditional healer or the traditional doctor is putting in. So because of that, I believe that this type of things, it doesn't work. We know science and we know what science can give us. And we already have proven evidence-based proof that there are some particular drugs that work against diphtheria. So why would you go and be mixing some herbs and some blood of some animal and claim that this can actually heal you from this particular illness? That doesn't make sense. I mean, I'm just trying to think basically. Just think about that and think about a drug that has been proven to be effective. So does it make sense? So or particularly some people would, because usually what they do is herbs. They do herbal concoction, right? And sometimes they will even add some blood of animals or some other things like that.
Nothing as nutritious
yeah.
as chicken blood.
Yeah, well, some even think that it's a religious thing, so they will feel that once the pastor preaches to them, puts their hands on them, they'll be free from the disease. So I don't want to say anything regarding that okay, you shouldn't believe, you shouldn't have your beliefs, but at the same time, there's science and there's evidence behind it. And it has been, I mean, there are other countries in the world where diphtheria, you've not heard about diphtheria disease in centuries. But of course, in developing countries like Nigeria, you hear about it, and there are reasons for it. Like I said, the vaccine coverage status
Still
that
not
is
as
low.
high as it should
So of
be.
course, these things will be out there. So it's not the village people that are out to get you. It's not a spiritual attack.
Spiritual.
Thank you, Dr. Cassie. So I remember when Ebola we had our outbreak here, and people were resorting to things like smoke baths, to get rid of it. And so I'm glad that you haven't kind of come across that kind of housewives remedy, and it's more along the lines of herbs and things you can still ingest. But people, whilst religion is obviously the key and at the heart of a lot of our lives, and that is good, but also you are living in a world that's in which science is a part of it. And so if you have a contagious disease, you cannot be around other people. So let's just put that out there.
Exactly. And knowing that science has actually proven or has a proven way to deal with the disease, I mean, it just makes sense for you to actually toe that line. All right, now this is very important to ask. And what challenges do public health officials face in the prevention and treating diphtheria? Because I know that, like you said, 70% vaccination. There must be issues concerning, this disease.
Concerning immunization. Yeah, I mean, there are definitely various challenges, starting from the primary healthcare themselves, right? Facilities. Sometimes the vaccines are not, available. Sometimes they are limited in number. And that's why I can sympathize with people when they say, okay, you tell us to go to the primary healthcare center, and yet I got there, and then they tell me the vaccines are finished, or they are not available. So they expect you to come the next day, and they'll tell you the same story. So of course, things like this can definitely, dissuade you from even coming to the primary healthcare center itself. So those are some of the challenges. Then of course, let me think. Yeah, so mostly is this limitation, this vaccine unavailability.
Shortages, not having enough to work
the
with.
shortage of that. We don't want to talk about other aspects right now.
Very diplomatic. We've come to the end of the show, but I just want to find out, is there any kind of last words that you want to say about this? And also, is there anything that we as citizens who are trying to stay healthy and whatnot can do to help the medical professionals when it comes to stopping the spread and
preventing
else
the disease? Yeah.
of diphtheria?
So I'll just say, like I said at the beginning, diphtheria is not a new disease, okay? And based on the mode of spread, it's obvious that due to our environment, crowding, bad hygiene, lack of wash, all those things can contribute to this infection. So if you can just, take some precautions, right? Just those simple precautions, trying to make sure that, okay, in our houses they are well ventilated. I know it's not easy, but just try. Also making sure that if you're sick, that's not the time for you to go to a party and infect everyone else.
You need to be responsible.
That's for you to
Yes,
be
please.
responsible and isolate yourself and go to the hospital.
None of that COVID-19 party behavior that we saw.
Yes,
please. Another story entirely.
Exactly. So those are just some, and of course making sure you wash your hands every time. Please just wash your hands. Don't think it's just for COVID. It's for anything. You protect yourself and you protect everybody. So just save lives.
Wash your hands, save lives.
I'm gonna wash my hands after this. Yeah.
Do you know when you were saying that, I was like, oh, I really need to wash my hands.
Yeah, I need to wash my
It's been a
hands.
while. Let me wash my hands. All right.
So those are just some of the things. So prevention is key. This disease should not be killing these children in all the states. It shouldn't. We shouldn't even be hearing about diphtheria outbreak at this point.
Yeah. Well, you think we were past something and then we go right back. Polio. All right. Dr. Cassandra Akinde has been our guest, and please, where can we find you? I know that you're up on Instagram at Cassandra Akinde, right?
Yes, Cassandra Akinde. Then I'm also on LinkedIn.
Okay.
If someone wants to get in touch with me, that's at Cassandra Akinde. So that's I use my full name.
Okay.
Then at Twitter, I'm at Akinde Cassandra.
Oh, okay.
All right.
A little different flavor for each one. I like it. All right, thank you so much for joining us. Thank you for the light that you've shown on this, and also people. She said it's wash your hands, save lives. I think that needs to be your motto. Thank
Yeah,
you.
wash your hands, save lives.
Love it. All right, that's that for Smooth Health. We'll be back next Thursday with another fantastic health piece to just keep you updated, informed, and making sure that we all live our best healthy lives. Coming up, we've got great music, and we'll also be taking your messages from 5 at 5 in a bit. So just keep it tuned, keep listening. We are Smooth.
On the drive.
Yeah, they're gonna smooth. All right, thank you so much.
Thank you,
5:15
Sope.
p.m.
I enjoyed it.
This is
Think I'm
Smooth
deaf
Health
after
on the
this.
drive.
It can't be